This is Inga, who is from Stockholm, Sweden, and we've been chit-chatting away, just having a fabulous conversation. And I wanted to ask you, Inga, tell me what you know about Lyme's, because you were bitten by a tick when you were younger, and you actually contracted Lyme. So tell me what you know.
Well, I lived in the Stockholm archipelago in Sweden, which is very heavy with, first of all, ticks and Lyme's and also tick-borne encephalitis. So medical profession's pretty clued up because this is a very, very big problem. They have what they call the vaccine boat, which goes around the archipelago, and you can get a vaccine for tick-borne encephalitis, but not for Lyme's because it's a bacterial infection. It's a spiral-shaped bacterium. It is very sneaky. It can hide in your body, which is why it is tricky to get rid of if it's not discovered quickly. Always do a tick inspection if you've been out in grassy areas or in the forest, anywhere really, if you know that there's a lot of ticks around. Very important. Very hidden. They like to bite you in the groin and all those places. So sometimes it helps to have some trusted friend or family member who look in the darker places. I got bitten. I was 9 months pregnant with my oldest son at the time, so it's about 20 years ago. I did not show the classic bullseye, which we know today is actually more typical symptom with men and not so common with women. So sometimes women get misdiagnosed. They gave me antibiotics for 10 days, if I remember right, and I am clear. However, that's a success story. It's not that common. It doesn't always, and the course of antibiotics don't always take care of Lyme's, unfortunately. I know several people who have chronic Lyme's and then it has progressed into worse conditions, which is a big problem. There's lots of things you can do in terms of diet, in terms of plant medicine, and looking after yourself in general from a holistic perspective, but it can be a journey for people.
So when you say you were on antibiotics, share what you know about antibiotic use for someone who has Lyme's or suspected Lyme's.
You know, the antibiotics that they use, to the best of my knowledge, because I'm not a pharmacist, if treated very early on, can be very successful. But I don't think anyone knows, you know, the time scale we're talking about. Was it 48 hours later, a week later? I think we do know that if it's not discovered, if you do go on to develop flu-like symptoms, body aches, you know, all the classic symptoms, then you've probably had it already for a month or thereabouts.
Right.
And I think that's kind of, to the best of my knowledge, the sort of timeline where it potentially can then be more difficult to treat. Basically.
So it sounds as though doxycycline, though, we looked it up on the Swedish website. It sounds
like
like the Swedish website takes it quite seriously.
Yes,
so they suggest anywhere from 10 days to 3 weeks. Doxycycline.
And apparently after that, it doesn't appear to increase efficiency. So, you know, beyond 3 weeks, there doesn't seem to be much point continuing to take antibiotics.
That's very important. And then when you finish the antibiotics, I guess some good probiotics to restore your...
you need to repopulate your gut.
Yes.
That's very, very important.
So that's very interesting that in Sweden they do take it seriously, and they seem to have a good protocol to be proactive at the beginning.
Yes, absolutely. I mean, it is a big problem. You know, we have red zones in Sweden.
Wow.
You know, you can look on a map where you have the tick-infested areas where this is a big problem. It's largely due to the fact that we don't have the apex predators, wolf, bear, and we have an overpopulation of deer.
And they can.
And they are the tick carriers.
Interesting.
Thousands of ticks on
Now,
one single little Bambi.
So this is really anything else that you can take besides the doxycycline that you would, if you suspect you have Lyme's, what else would you take?
I would look at antiparasitics.
So ivermectin or?
Ivermectin being a pharmaceutical drug, but we know that, you could use things like garlic, neem, andrographis. I think diet is crucial.
Talk about diet a little bit.
An anti-inflammatory diet. Absolutely no sugar at all. Probably quite a carbohydrate restricted diet. And look carefully into which type of fruits and vegetables that you eat as well.
So low glycemic.
Not only, there are other issues too, and it's a little bit specific to perhaps go into just briefly, but I would possibly stay away almost entirely from fruit because of the fructose content, for instance.
Yes.
Small amounts of berries maybe.
Okay.
Yeah.
Okay.
Yeah.
Very interesting. And then my last question is, did you read the book Bitten? Because there's a woman. Oh, okay. There's a woman from Stanford who was plagued with Lyme's, and she went on a deep dive as a researcher and discovered that it looks to be a bioweapon. So it looks like it's come out of a lab. And the book Bitten, and I think they made a documentary about it as well. But she is a researcher from Stanford, so she no big funding for her research.
I've heard this before. I'm not entirely sure, but I seem to recall that the type of, so there are two types of Lyme's bacterium, and they are slightly different, and I think the one you're talking about is prevalent in North America. It is not identical to the type of bacteria, Borrelia bacteria, that you get in Northern Europe.
Interesting. So maybe the Northern Europe variety is more of a natural one, and the North American one has come out of a lab.
I really don't know, because I don't know the history of when this started appearing. In fact, when awareness of the Borrelia bacterium was, I don't know the history of it at all.
Has the incidence of Lyme's gone up in Sweden? Or has it always been a problem?
So, yes, it's spreading. It's spreading further north, whereas before, it was sort of concentrated down in the south.
Yes.
It's sort of going further and further up. Obviously, to some degree, there have been changes in weather over the years as well. So, that might be a contributing factor. But whereas, up in the Arctic Circle, there was virtually nothing.
Yeah.
I think it's just traveling
creeping north.
Yeah.
Interesting.
Yeah.
Well, Inga, thank you so much for your
welcome.
input. Lyme's is one of those big mysteries, and it's so heartbreaking because it can be quite debilitating.
Absolutely.
And it's tragic that people are often accused of being, it being a psychosomatic situation when it truly is a health issue.
Absolutely.
So wonderful, wonderful information here. Thank you so much. And I'm talking to the right
you.
person as a Swede because it's quite prevalent there. So thank you.
Thank you.
Okay.